telling us that the former head of CDC went to you. You asked her, are you a trustworthy person? And she said, no, I am not a trustworthy person.
She didn't say, no, I'm not a trustworthy person. She said, no.
Wow.
Giving a quote. And I asked her twice.
No, 1 second. And you're also repeating now that she is a liar, correct? What you wrote in the Wall Street Journal.
If she wrote that I fired her because she refused to sign on in advance for the ACIP committee, no, that's not accurate.
All right, so you're calling her a liar, and I look forward to her coming before the Help Committee, maybe this committee as well. All right, Mr. Secretary, I've got a bunch of questions. Appreciate brevity in answering it. So-called beautiful bill threw 15 million Americans off of health care, substantially raised premiums, and is going to have a terrible impact on nursing homes, community health centers, rural hospitals all over America. Very briefly, is that really making America healthy again?
It's going to have it's going to be the biggest infusion of federal dollars into rural health care in American history.
Yeah, you know why? Because you're cutting $150 billion for rural hospitals. You're putting $50 billion back. That's not an infusion. That's a loss of $100 billion. All right, next question. President Trump, who I don't usually agree with, called COVID vaccines, quote, one of the greatest miracles in the history of modern-day medicine that saved tens of millions of lives worldwide. Scientific community agrees with Trump. Lancet study found that it prevented almost 20 million deaths during their first year of use. Secretary Kennedy, are President Trump and the medical community right, or do you still believe that the COVID vaccine was, quote, the deadliest vaccine ever made?
No, first of all, I didn't say that. Oh, I said that in terms of affairs reports a while ago. I said today, I think that President Trump should get the Nobel Prize.
So who's right? Is Trump in the medical community right, or are you right?
President Trump did an extraordinary piece of leadership.
Is he right or wrong? Did COVID save millions of lives?
As I said, he got Americans back to work. At that time, that particular vaccine was perfectly matched to the virus that was circulating then. And I have no idea how many lives it saved, but it saved quite a few.
You know, what I find a little bit weird in this discussion, I'm hearing it over and over again this morning, Mr. Chairman, is we've got the entire medical community on one side. You got the AMA representing hundreds of thousands of doctors, the American Academy of Pediatrics, the American Public Health Association. All of these organizations are telling us that COVID vaccine and vaccines in general are safe and effective. You are casting doubt on that. Who are your who are the organizations that are agreeing with you and casting aspersions on vaccines?
The primary advisors are Marty McCary, Jay Bhattacharya, Dr. Oz, Vinay Prasad.
So you got a few doctors who agree with you, and I'm giving you the
Not a few doctors. What you're talking about is there's a big difference, Senator, between established science and the scientific establishment, which has been co-opted by the pharmaceutical industry.
So you're telling the American people that the American Medical Association, representing hundreds of thousands of people, have been co-opted and that they should not trust their doctors.
And I'm
the American Academy of Pediatrics, and by the way, just for the record, every single Republican, I don't mean to be political here, Mr. Chairman, has received PAC money from the pharmaceutical industry. Are they all corrupt as well?
And I'm telling you, the American Heart Association has been co-opted by the food
Everybody
industry.
but you, Senator. But you know what? When you ran for president, you know, we have a corrupt campaign finance system. Maybe you will agree with me on that. Okay, you were already president, you got a billionaire behind it. You received $300,000 from people, not from the industry, people in it, as I did, from individuals. You corrupt. President Trump got $3 million. Every Republican got corporate PAC money for the pharmaceutical industry. Democrats as well. Everybody is corrupt, but you? Is that what we're looking at? I don't think so. And I think the issue now...
I don't even know what you're talking about.
Well, I think you do know what I'm talking about.
I don't know what you're talking about.
The issue is every time anyone disagrees with you...
Are you saying the pharmaceutical industry was supporting my presidential campaign?
I'm saying,
I don't think so.
I'm not saying that. I'm saying that the pharmaceutical industry is a greedy institution which is charging us the highest prices in the world. They are pervasive. But to suggest that every institution, the AMA, the pediatrics people, is corrupt because they disagree with you is an insult to the American people.
Listen, people disagree with me all the time. I have arguments in my agency, heated arguments every day with Jay Bhattacharya, with Marty McCary, with Dr. Oz.
You have given the names of a few people. I have given you the names of organizations representing hundreds of thousands of doctors and scientists. I yield, Mr. President.
Senator Tillis.
Do you accept the fact that 1 million Americans died from COVID?
I don't know how many died.
You're the Secretary of Health and Human Services. You don't have any idea how many Americans died from COVID?
I don't think anybody knows that because there was so much data chaos coming out of the CDC, and there were so many perverse incentives, and these are model studies.
You don't know the answer of how many Americans died from COVID. This is the Secretary of Health and Human Services. Do you think the vaccine did anything to prevent additional deaths?
Again, I would like to see the data and talk about the data.
You have had this job for 8 months, and you don't know the data about whether the vaccine saved
and
lives?
that's the problem, is that they didn't have the data. The data by the Biden administration, absolutely dismal.
So who is politicizing? You're saying the Biden administration politicized all the data? Go back to what Senator Cantwell just said.
They fired Dr.
Go to the Trump Surgeon General.
They fired Dr. Kraus. They fired all the people who questioned the orthodoxy. They fired Dr. Gruber, Dr. Kraus.
So, Mr. Chairman, the Secretary of Health and Human Services doesn't know how many Americans died from COVID. Doesn't know if the vaccine helped prevent any deaths. And you are sitting as Secretary of Health and Human Services? How can you be that ignorant? Like, you know, I remember when we went through the hearing with you, I asked you about community health centers. You didn't know what role they play. I've been visiting community. I'm glad you got to one, I think in April. I tell you what I hear on community health centers, they are terrified, with all due respect to my good friend, the chairman, of the big awful bill, because they are going to lose health care across the board. They already live in food deserts. They can't get to a nutritionist because Medicaid doesn't do enough reimbursement. If you're going to want Americans to get healthier, should they have access to nutritionists? Should they have access to good science about healthy food?
Absolutely.
Well, then, how is that going to happen with the Medicaid cuts that are taking place?
There are no cuts to Medicaid.
Sir, that is an absurd. There is not a single, some of my Republican colleagues, but there is not a single study that does not, and I can tell you, I was in Franklin, Virginia a couple days ago. The rural hospital is going to close. The hospital system was so afraid they wouldn't even let me have the meeting there. But that rural hospital is going to close. And they are looking for where those folks are going to go. I mean, you're supposed to be doing health care policy, not being the doctor in residence for all of America. I hope I can just say, I'm still going to trust my doctor rather than your health advice. And obviously, Tom Cotton's going to, who knows who he's going to trust. But let me go back to policy for a couple, so maybe we can lower the temperature a little bit. I got a bipartisan bill that would be a systemic fix, not a vote-buying mechanism when Medicaid's getting cut, what was put in on the rural hospitals. One of the things we could do, Mr. Secretary, is make sure that the folks who work in rural hospitals get an 80% reimbursement of what folks get in more urban centers. Would you support that legislation?
Are you talking about the area wage index?
I'm talking about the area wage index and moving that up to 80%, so there is actually ability to get rural providers.
President Trump supports that, and we support
Do you support?
that.
You support? Good. So you will work with us to get that passed.
Yes.
That will increase costs on both Medicaid and Medicare, so you are committed to that. I appreciate that. What about Senator Wyden and I've got a bill, because across America,
What about what?
Hospitals are shutting down on their OBGYN services. Try to have a baby. I don't know about in all of my other friend states, but in Southside Virginia, you can't find a hospital. Will you work with us to make sure that before OBGYN services are taken out of a rural hospital, there has to be a process and procedure?
I'm happy to work with you on that, Senator, meet with you and see if we can work with you on it. I don't know exactly what the issue is.
Well, again, the Secretary of Health and Human Services, who has said he doesn't know how many people died from COVID, doesn't know if the vaccine saved lives, doesn't understand the issue that OBGYN doctors are fleeing rural America because they can't afford it. And with the cuts that are coming up, it's going to be exponentially worse. I would invite you, sir, to come with me to a community health center in Virginia and hear what is on people's mind. They want to get healthier? Absolutely. Count me in. But they also don't want their basic health care removed. Thank you, Mr. Chairman.
Thank you, Mr. Chairman. So last November, while you were under consideration to become Secretary of Health and Human Services, Mr. Kennedy, you said, quote, if vaccines are working for somebody, I'm not going to take them away. No exceptions, no ifs, ands, or buts. You would not take away vaccines from anyone who wanted them. Then last week, you announced that the COVID-19 vaccine is no longer approved for healthy people under the age of 65. In announcing the change, you said the vaccine will be available for anyone who wants it. Now, obviously, both things cannot be true at the same moment. So let's clear this up right now, Secretary Kennedy. Will you tell America that all adults and all children over 6 months of age are eligible to get a COVID booster at their local pharmacy today?
Anybody can get the booster.
I'm sorry?
Anybody can get it, Senator.
Anybody. So you're saying that is now the official rule of HHS. Anybody is eligible to get a booster by just walking into the pharmacy.
It's not recommended for healthy people.
No. If you don't recommend, then the consequence of that in many states is that you can't walk into a pharmacy and get one. It means insurance companies don't have to cover the $200 or so cost. As Senator Dr. Cassidy said, you are effectively denying people vaccines.
We're not going to recommend a product for which there's no clinical data for that indication. Is that what I should be doing?
What you should be doing is honoring your promise that you made when you were looking to get confirmed in this job.
You're going like this.
And that is, you promised that you would not take away vaccines from anyone who wanted them. You just changed the classification of the COVID vaccine.
I'm not taking them away from people, Senator.
It takes it away if you can't get it from your pharmacist.
Well, most Americans are going to be able to get it from their pharmacy for free. Most Americans will be able to get it from their pharmacy for free.
The question is everyone who wants it. That was your promise,
No, I didn't. I never promised that I was going to recommend products for which there is no indication.
When you said...
And I know you've taken $855,000 from pharmaceutical companies, Senator.
Did you hold up a big sign saying that you were lying when you said that? Because you are the one who said you would not take them away. Now, Senator Kennedy,
I'm not taking them away from anybody.
Secretary,
you want me to indicate a product for which there is no clinical data?
Senator,
is that what you want?
Secretary Kennedy, you said you wouldn't, and now you did.
I'm not taking them away. Everybody can get access to them.
No, they can't walk into a pharmacy the way they could last month and get access.
It depends on the state. It depends on the states.
A year ago,
but they can still get it. Everybody can get it. Everybody can get it, Senator.
So look, let's move on. You clearly are taking away vaccines. I've seen the list for what's coming up next, and that is the agenda for the next CDC vaccine panel. And first up is ratifying your COVID actions. Second is hepatitis B is on the agenda. So should Americans expect you to take away hepatitis vaccine access as well, even though you promised not to?
As I said, I'm not taking vaccines away from anybody.
Okay, same answer, right? You're just going to deny that when people can't get access, that you're not taking it away. Then let me ask you, is that the same game you're going to play with measles,
you want me to,
mumps,
so you want me to
rubella,
recommend
chickenpox?
every product in the world so that
I
without
want you
any
to
clinical trial
follow
data?
through on your promises.
Yeah, my promise was to give.
A month ago, we could get COVID vaccines by just walking
You can
into a
still get
pharmacy.
COVID vaccines,
You
Senator.
are taking that away.
No, you are
So
still,
let me
you can
ask
still
you
get the
one more
COVID vaccines, and
question,
Medicare
Secretary
will still
Kennedy.
pay for them, and Medicaid will still
Tell the
pay for them.
head of the CDC that if she refused to sign off on your changes to the childhood vaccine schedule, that she had to resign.
No, I told her that she had to resign because I asked her, are you a trustworthy person? And she said no. So if you had an employee who told you they weren't trustworthy, would you ask them to resign, Senator?
So I'm sorry, but this is not what she has said publicly. She has
Well,
said
I'm
she
not
was
surprised
told to
about that.
reapprove. So you're saying she's lying?
Yes. Every conversation I had with her, there
And
were
let me get this
witnesses.
straight. This is the same person that less than a month earlier, you stood next to her and described her as unimpeachable, and you had full confidence in her, and that you had full confidence in her scientific credentials. And in a month, she became a liar? Is
Yeah,
that what
you
you're
should
saying?
ask her what changed. And by the way, a month ago, you were voting against her. Oh, because you thought she was either incompetent, ineligible, or unsuited to the task.
I voted
Now I
against her
agree
because
with
I
you.
was afraid she was going to bend the knee to you and Donald Trump. And it looks like she didn't bend the knee, so you fired her. Look, you're putting America's babies' health at risk, America's seniors' health at risk, all Americans' health at risk, and you should resign.